Thank you, Dimitri and gang. Neil's got to go hurry and order his ruby red slippers. So, okay, so we're going to be going around with a bag for the raffle. We're going to just drop your business card in the bag, and that's how we're going to do the raffle at the end. So there'll be a couple people going around collecting your business cards if you want to get them out now. All right, we got Sue all ready to go. I'm hearing crickets back there. Sue, ready to go? Okay. Okay, you need a few minutes. Okay, well, in that case, speaking of ruby red slippers, tariffs on shoes? Guess the government's trying to heal the economy. Okay. Okay, next is a conversation on healthcare supply chains, AI, and innovation. All the way from the University of Utah is our moderator, Dr. Sue Sundar. So please welcome her and her speakers. We need one more microphone.
Hello, hello.
Hello, hello. Hello, hello, hello.
Hello. We are epitomizing supply chain at the moment and rolling with everything.
Hello, hello.
So give us just 1 sec. Down there.
Oh, is there a way? Oh, so it's just stuck there. Okay. Okay.
There you go.
Oh, yes. Okay. So I'll just.
You want some water?
So I know.
Oh.
I have 225 as a crowd. 225. Okay. Okay. I guess the music is on, so we can. All right. Good afternoon, everybody.
Hello, hello, hello.
Hello.
Good afternoon,
1,
everybody.
2, 3.
Thank you for sticking around. See, these are the smart people left in our audience who actually chose to stick around for the very last session of the day today. Thank you for that. And we will be talking about one of the most important topics, healthcare and AI. And our topic for today is building resilient and smart healthcare supply chains. How do we leverage AI technology, and innovation. We will start by introducing our panelists, and then we will dive into our topic. So let's start from my right here, and then we will move this way. We have Karen on my right, Liana, and Arman, and I'll have them introduce themselves and give a little bit of background in terms of their what kind of jobs they are in, how they're involved in the healthcare field, and then we will dive into our topic for today. All right, Karen.
So Karen Betancourt, wonderful to have me here. I appreciate it because I am new to the LA area. Most recently, I was CEO of a medical logistics company operating in Central and South America. Before that, Amazon and Walmart. So taking a lot of industry experience and bringing it into medical care. Throwing it over to Liana.
Good afternoon, everyone. A proud USC alum here. I am currently serving as the Associate Vice President and System Executive Director of Rush MD Anderson. For those of you who don't know, it is a 3-hospital system that serves the Chicagoland area based in the West Side. We have a strong lens on equity as it relates to AI, technology, and innovation. And I focus specifically in the oncology space. So I oversee cancer services across our 3 hospitals, and it generates about $500 million in net revenue for our system. And my focus really is on bringing groundbreaking therapies, accelerating those to patients and families in locations that they need it. Turning it over to Arman.
Okay, thank you so much. Hi, good afternoon, everyone. My name is Herman Estrada. I'm executive consultant for Calafia Business Management Technologies. For those of you who do not know, Calafia is a consultant firm dedicated to help organizations to achieve and sustain their goals, their business goals, through supply chain transformation. And why am I here? Well, it's the intersection of supply chain and digital transformation, and in particular in the pharma industry. I have had the privilege of working in global projects for Sanofi, for Amgen, for Pfizer, and also back in Mexico for national-wide projects and initiatives for the biggest brand in Mexico and Latin America, such as National Pharmaceuticals and name a brand name called PISA. And I'm very thrilled to be here with you, sharing some thoughts about how to achieve resiliency and make more smarter supply chains. Thank you so much for having me.
Yeah, thank you, Karen, Liana, and Arman. I will introduce myself before we start. I'm Professor Sue Sundar. I'm at the University of Utah. I'm a professor there and also the director of the Operations and Supply Chain Program. Raise your hand if you're a student here. How many of you are students? Raise your hand. Great, awesome, so wonderful to see you. This session, in fact, I would say the entire USC session, the last 2 days, is made for you guys, so we can help you jumpstart your career, trajectory. Learn from all the speakers that you will be meeting, that you have met yesterday and today, and so hopefully that'll help you sort of determine where you want to go with your degrees and all the specializations that you're earning along the way. So the COVID-19 pandemic exposed a lot of issues in our healthcare system in terms of all the shortages that we faced, and for example, the PPE, just as an example, how there was a huge disconnect between the supply and demand. We had all these PPEs, for example, somewhere lying, waiting to be used, but then these hospitals didn't know where to find them. There was a total lack of information. We didn't know where to find them. And so, especially healthcare is really important. Why? Because it deals with human lives. Any issues in healthcare directly translates to affecting human beings and affecting patients and affecting human lives. And so for that reason, it's important that we really think about our supply chain. We help make our supply chain more resilient, smarter, especially in today's world, we want to use AI to be able to do that. So I want to start our session today by asking a few questions from our esteemed panelists. And we will go in the order that they want to share their expertise here. But my first question is, what are some examples of where AI is actually being used in healthcare? Because all three of you come from that field. How is AI being used in healthcare today in your sphere? And what are you seeing as some, seeing the real uses or cases of how AI is being used? If you could share that with us, and you can go in any order.
Well, seems like ladies first, I was going to say. It seems like I'm going to be the one. Well, one applications very successful that we have seen is that for a particular need that this pharmaceutical company had, it was a global problem. Maybe you're aware of once the research team get the patent of a particular molecule, well, now it's time to commercialize that patent, that molecule, around the world. So when you get to a particular country, you need to fulfill certain local regulatory laws and requirements, and that impacts a lot of stuff in the commercialization process, such as all the tags, all the boxes, of course, all the advertisements, the coordination of the product launch. You need to coordinate all the samples with supply chain. And of course, supply chain, in particular, the production needs to make and fabricate all the drugs and put them in the different inventory locations. So all that coordination was a mess, was a problem. And so the application was about very simple. It was not a major, big IT transformation or supply chain transformation project. It was a very well located, value located initiative where what we did is based on the data available from different sources. One of them was the source about all the regulatory information on the one hand. Then we have all the coordination of marketing materials, collaterals, and all the stuff that helps to promote the drug in the market. All the samples, where do we need to distribute the samples, how many or how much samples do we need to distribute, and also the inventories, right? So all those sources, we use Llama software, which is no cost because it's open. The IT guys help us to build in, well, actually it was a big knowledge base is how we call it. And that knowledge base had two instances. One was a typical instance where you have, it's like a big spreadsheet with numbers and different variables. And then we have another one that is called semantic or vectorial database, where we can find easily, we do a very fast search of stuff based on some keywords, right? And they give us some information around that keyword. So with that, we use, again, Llama software and some APIs and some interfaces, and we use RAG logic, and we put a very simple chat in their Excel spreadsheets. So the coordinators within a country, they can chat with the entity, the AI entity, and ask questions about multiple things. One of them, of course, what were the limitations, what was behind schedule, etc. So with that, they can be more efficient and optimize the whole coordination. And at the end, give dates to the executives to say, well, you know, we are ready to launch this particular product in this date. And with that, it helped a lot the organization and save a lot of cost, effort, and primarily a lot of discussions and arguments and why things are not ready, et cetera, et cetera. I just would like to, before I jump to someone else, it was key that people understand the process, because otherwise the knowledge base, remember that in AI, we need to train the algorithms and we need to make sure that the knowledge base is accurate. Otherwise, we're garbage in, garbage out. But once you get the information very quick, again, it's on your desk, the responsibility. You gotta make a decision and tell the executives or whoever, well, this is going to be the date. And AI, remember, is good for certain things. At the end, it's not good to deal with contextual stuff. So because it's so much what AI can do. So at the end, you need to make a decision. So I would say that that was a successful project, not because of the AI only, but because of the people that was involved, developing the technology and implementing it, but also the people that was executing the process and using the technology, because they were validating that all the information and everything that was coming out of that application was right. Believe me, we found a lot of mistakes, and still we are finding a lot of mistakes. I'm guess, well, it was a little bit of time, a couple of months that we left, but yeah, I'm sure that it is happening.
I really like, Armand, your example around coordination. So from a health system perspective, we are really looking at orchestration. So if we were to pull back the curtain like Armand did from a health system perspective, do you all know what it takes for you to actually be seen by your provider? We've got scheduling, we've got prior auth, we've got supplies, we've got nursing ratios. There are a slew of processes and systems that are built behind that visit that make sure that you're not waiting in that waiting room for very long, that you are getting your chemotherapy at the time that you are scheduled, that there are no further delays in terms of when you're going to be getting your surgical oncology and getting your tumor resected. So I really like the fact that you said AI is used for orchestration, and it is exactly for that. From our perspective, we see AI as a coordination tool, and it's really to decrease that administrative burden. There are hundreds of people that go behind the engine of making sure a hospital run and that you deliver care, or at least we deliver care in the way that you expect it. So I think for us, one of the things that we're definitely looking at is coupling AI tools that really help improve the efficiency of our providers. So ambient listening is here. There are things that we're also working on in terms of surfacing clinical trials. As a cancer patient, that's standard of care. You want to be able to get access to those early therapies so that eventually you'll achieve remission, I should say. So the other last example that I will talk about in reality that healthcare is currently using is also predictive analytics. So when we talk about scheduling and ensuring that you're not waiting that hour or half an hour in that waiting room, we are looking at how we have nurses and MAs coupled with the demand schedules so that it becomes very efficient and that you can go in and out that door back to work or to your family as soon as possible.
So I think I have the most boring and yet most practical application of AI that we are using in healthcare. And those are in two ways. So one, in planning. So tools like Kinaxis, if you're a large company like Cardinal Health and managing lots of manufacturing as well as distribution, or OnePint.ai, if you're using that for smaller spaces, is It's just planning your supplies. What does that look like? That's data that we've had since the 90s, but getting it all organized, making sure that your units of measure, spoiler alert, for those of you who are not in deep into medical, everyone has their own preferences. Some hospital systems like things in packs of 8, some like them in packs of 12, some of them will only buy them in packs of 144. And every single one of those is a new SKU, which adds for lovely, lovely planning. And AI is a hell of a lot smarter than the average human. And so it's a space where SKU rationalization and planning is really coming into play. Second, actually before I go, can anyone estimate how many semi-truckloads of gloves I had to dispose of after COVID-19? Because they were out of date. Any guesses? Semi-trailers full of gloves, 57 cartons on a pallet. 10. Okay, I got 10. Anyone else? Okay, 500, good God. Okay, not that bad. Okay. 114 full semi-trailers of nitrile gloves, all out of date. I was trying to push for them to be donated to like some artist to make like a sculpture, of COVID-19. One of those things from Star Trek, you see everything left after a population is gone. There was going to be my glove sculpture, but sadly, we did not pursue that. But the second space that is super interesting and incredibly difficult to execute is people expect Uber level or Amazon.com level tracking of their shipments to their hospitals. And guess what's incredibly difficult to do? Because you are not using your own fleets. In the case where I was running enterprise logistics for Cardinal Health, and I actually did, in some cases, have all my own drivers. The big problem that you have is that there is a tremendous amount of institutional knowledge that is only existing within the head of the receiving clerk and or the guy who has been, or the girl who has been on that route for 20 years. And so one of the difficulties that as you expand predictive AI, we were doing really good with predictive ETAs. They were very, very good when I had full transparency. It was my route. I was every stop on it. But I don't know if you guys have heard, the healthcare industry, nobody likes to pay for anything, and it's already way too expensive. Has anyone heard that? Yes, way too expensive. Nobody likes to pay anything. Well, I would commingle shipments, and that means I don't control every stop. I don't control everything, but I needed that detail back with scans to be able to tell people when they were going to get delivery. Because if you are waiting on the cath lab on floor 4, you want to know if you need to send your receiving guy there at 3:15, or if tomorrow I'm going to be surprise 11:20. That's a big deal. And a space where predictive ETAs are improving dramatically. It is a space where the more data that you have, the better off you are. But there's a tremendous amount of crap that is not available, except for in the heads or in the real world. And so that's the gap that we're working on right now.
Thank you, Karen. Thank you, Liana and Armand. Those were some great examples. My next question to you is, do you have examples or instances when AI systems actually broke down at your company? Can you share some stories there?
Well, I'll share slightly one example, and I've told the panelists this. So going to the predictive ETAs makes perfect sense. Big hospital systems. In the medical distribution world, everything's done on contracts. You have evergreen contracts, but you have your big salespeople. There's always something up for renewal. It's incredibly important that you deliver precisely on time, and scrutiny is very high. And so we had a very large medical system where their contract was coming up to date, and we had just recently changed over drivers. So 24-year driver had the route, switched over to someone else. It was a beautiful rate. Everything looked wonderful in our modeling. It's going to be exceptional, phenomenal. And we all of a sudden started having failures. We had consistently been delivering. By 10:45, we were on site. By 12:20, we were out of the hospital, and there were 18 stops within that hospital. Okay, sounds fantastic. And all of a sudden, our predictive ETA, which is built off of our data, keeps getting later, and later, and we start seeing end deliveries at 3:20, and it's the new driver who's trying to figure out all this stuff. And so we start yelling. I would never yell. But there might have been people under me who might have been yelling a little bit. We were giving people a hard time. But the assumption was the driver was terrible. The driver was too dumb to do this. We needed to return back to the person. It was a whole thing. When we root caused what the problem was, we found that there was a 34-year veteran receiving clerk who had recently retired right before the 24-year route person had done this. And for 24 years, no one knew this was the system. But the receiving clerk had a key-operated freight elevator that he would receive and know that this person was here, and he had it blocked. So from 10:30 to 11:15, he let the freight elevator be used so that he could then go on his lunch at 11:30. This is perfectly reasonable to every single person. Who was it earlier in the panel who had the deliveries that were coming on Monday so that they would get to by Wednesday so they would have delivery? It worked seamlessly for 24 years. Except we got a new receiver clerk. And all of a sudden that new window for the key operated freight elevator wasn't available. And our driver, who's getting fussed at constantly, is trying to figure out how to be successful. And the AI and everything that we could see, which was only scan data, and when someone managed to yell at us because we had missed a delivery time, the root cause was actually that this freight elevator wasn't available. That information was in the heads of a bunch of people. And so it's the combination, I think somebody out on a previous panel called this out, the combination of real world and people engaging in these things to make them succeed is a space where we need humans. We have a tremendous amount of data that is in databases. I'll use brains as a database equivalent, databases that are not accessible to AI. And so it's a space where it went wildly wrong. Temporarily for 6 weeks, I had to pay $180 every single day for a direct route straight out of the distribution center to be successful until we figured out. Regular cost of delivery, does anyone want to guess? $180 if it's a straight shot, only one stop. What's the regular cost of delivery for that hospital? Oh, none of you are nerds? Okay, I'm a super nerd. It's $38. $38 a day to $180 a day. Huge impact, all caused because we got a new receiving clerk. And the new delivery guy didn't know to ask the guy when his lunch was going to be.
I have a similar example where predictive analytics did not predict what we were experiencing. So late, I want to say probably spring of last year, all hospitals were actually experiencing this issue, but a manufacturing plant went down and they made IV fluids, which are incredibly important. So as you're getting chemo, you've got to have IV as well because it really does dry you out after your chemotherapy regimen. So according to our predictive analytics model, none of our infusions were starting on time. Also, they were not only delayed, but we were rescheduling because one of the things that we had to do, obviously we got a heads up from the organization that, hey, this manufacturing plant, which has 50% of the IV production, is down. With that being said, we had to triage our patients and ensure that the high priority patients making decisions off of where are they within their active treatment plan, are they newly diagnosed, is this patient just receiving IV fluids? I mean, that's not something our system was allowing us to do. And so that went back to manual work. What did we need? All of our nurses, all of our MAs, all of our schedulers to go back and go through every single appointment to make sure from a clinical perspective that we were prioritizing our patients appropriately and also communicating back to the patients who said, where did my appointment go? Why did I get rescheduled? Is that okay at this point in my time in my life? So that orchestration, again, couldn't be done by our predictive analytics model. And we had to use and rely on the databases of the humans to ensure that we were able to communicate back, decrease that anxiety level from patients and families as they're waiting for their chemo treatment.
Okay, well, I would like to start before jumping into the example. How many of you have a watch that follows and keeps track of your biometrics? Please raise your hand. Okay, how many of you that rose your hand use the VO2 max metric? Okay, 1, 2, well, we have less, right? The other ones that didn't raise your hand, the most likely is because either you don't need it, because you don't do anything where you're required to use it, maybe because you don't know that is right there, because maybe you haven't trained on how to use those biometrics, et cetera, et cetera, et cetera. When you jump into operations, supply chain operations, you find something like that. And is when I jump to my example. We just receive a phone call from a company that says, well, you know, our ERP system is not working in demand planning. All right, well, let's go and see what is going on. Because they were supposed to have the last version, which, by the way, has a lot of machine learning stuff inside in their algorithms that can supposedly help them to follow very well and keep track and predict somehow demand, right? But when we start analyzing what they had, we start just asking simple questions. So what is your S&OP process? Well, what do you call S&OP? What is S&OP? Well, it's a process where you have a meeting where you balance out your requirements from operations with your requirements from demand, and at the end you end up with one sole plan for the whole company, and everybody keeps track of that plan and execute that one plan for the company. Well, you know, I know operations, they have their own plan, and I know sales have their own plan. And well, and you don't have the meeting. No, well, we do have a meeting, but we pass the information. We not necessarily have a meeting. We have at the end of the quarter or of the month or whatever, we have some meetings to review what were the results. Okay, well, they don't have S&OP process. Well, then it triggers the next question. How do you plan demand somehow? Well, is where we use the ERP system and that particular module. Okay, well, that's fine. And who uses it? Well, the sales guys. All right. So you don't have an independent person who is running and using the program, the module for demand planning and the demand forecasting. No, are the guys from sales. So what do you think the sales guys were doing with that module? Someone, some ideas? No? Well, of course, the sales guys, instead of using the tool, they started using what they used to do. Guessings, spreadsheets, et cetera, et cetera. But at the end, it doesn't matter if you are doing it well. The thing is, what they were putting there, it was totally biased. And there was no such an instance, independent instance, that were questioning them. Hey, how do you come up with this number? Based on your history, you have never reached in this particular month or quarter or week of the month that particular amount. What are you doing special in order to reach that number? And the question was that, well, I just need to fill in the quota somehow. at the end, it was what's happening. So essentially, they were just filling in all the spreadsheets. They were not actually using it. So the process was flawed. They didn't have the proper distribution of processes along the way in order to do demand planning, right? And of course, the people that was running the process of demand planning and using the module were people that were not well trained, that were not specifically dedicating for that. And essentially what happened where the actual forecasting was happening was in the collaborative portion of the process, because always when you're doing forecasting and demand planning, you have the forecasting, which is the numerical part, and then you have the collaboration with all the sales force starts providing their own input. Well, these guys were just providing their own input and just disregarding all the math that was there. So essentially, it was a the problem was not the watch, that everybody has the ability to keep track of your different biometrics, is that you're not using it properly. So that's the moral of the story.
Thank you. I'm being told that we're actually out of time, so I think we'll wrap up our last session here, so we can move on to the award ceremony. But the one thing that I would like to say is that healthcare is more complex than any industry that we know of, because it deals with human lives. And to go back to our topic about building resilient and smart healthcare supply chains is not a choice, but actually it's something that we need to do. It's no longer a choice, and we need to do that. And of course, if we can use AI to help us be more resilient, that is exactly what we want to do. So I would like to thank our panelists for being here today. Thank you, Armand, Liana, and Karen. And thank you to our audience.
And thank you, Dr. Sue. Okay, so I know we were